Delivering universal healthcare coverage by 2030 is a key target of the 2015 Sustainable Development Goals. We actually saw during the pandemic COVID-19 what it means if we are not prepared for major crises. Scientists and companies from around the world developed and scaled up manufacturing of vaccines and treatments against COVID at record speed. But getting them to the people who needed them most was not only hampered by vaccine nationalism, but was also hampered by lack of country readiness, which made the rollout so more difficult. The Japanese government has always been a key champion, actually the leading champion of promoting universal health coverage. We saw this at the recent Hiroshima G7 summit, and as Prime Minister Kishida said in his article in Lancet earlier this year, achieving universal health coverage, UHC requires a whole of government and whole of multi-sectorial partnership approach. We saw this again at the recent high-level meeting on UHC during the UN General Assembly in New York, where again Japan was the leading champion of UHC. It's no surprise, because when one looks at how UHC came about in Japan, it was the result of tuberculosis being the #1 death cause in Japan in 1950. And it was a major initiative leading to one of the best healthcare systems in the world, which achieved UHC for Japan and shows that it can be done if there's political will. Today, actually, we all envy Japan for its long life expectancy, clearly the result of a very healthy diet, but also the result of a very strong healthcare system. We must learn from the experience of COVID-19. We must improve on getting innovation, medicines, treatments, and vaccines to the people wherever they live, wherever they are. That requires partnership across the board. We from the industry are convinced that we can play a critical role in it, and we have been part of the UHC 2030 partnership for a long time. We fully support and engage in the 8-point action plan for UHC 2030. And when I look at it, there are 3 critical elements which we need to focus on. One is make sure that the investments are taken to strengthen healthcare systems and health systems resilience. We must make sure that we invest more and we invest better in the healthcare. And we also need continued private sector innovation. We from the industry showed during the fight against COVID-19 that making medicines and vaccines available, affordable, and accessible for everybody is possible, and most companies used tiered pricing or at-for-cost delivery of innovation. I think we can learn from this experience in terms of how we can make medicines available and affordable, but we also need to work on maintaining an enabling system that fosters innovation. We need a strong regulatory system. We need the support of governments such as the government of Japan. We have a unique chance to learn from what Japan achieved 60 years ago, of what we saw what's feasible in the response to the biggest healthcare crisis the world was facing since Spanish flu in 1918-19, and only together, involving governments, international organizations, civil society and private sector, we will succeed. With this, I wish you a very successful conference, Nikkei conference on infectious disease. Let's work together to make UHC happen.